Hey, good evening, everyone. I want to thank you all for joining our weekly COVID town hall. We've got a full presentation for you. We're going to give you some updates around what we're seeing in COVID. Hear from Vice Chair August and hear from Dr. Wilma Wooten, our public health officer. And then we're very excited to have Chief Tony Meacham with us, Chief of our Cal Fire team, our San Diego County Fire. They've been doing incredible work, Operation Collaboration. In the early days, we vaccinated our firefighters so they could become vaccinators, and they've been doing some really great work in hard to reach communities. And we really appreciate Chief Meacham and his team and all of the Operation Collaboration, various agencies all coming together with one mission and one purpose to help vaccinate folks. Before we get into all of that, this week marks 1 year. It was 1 year ago this week we had our very first COVID case in San Diego County, and it's an anniversary that reminds us how long and difficult a year that this has been. And we recognize today and really every day, both the loss of life from the COVID pandemic, now more than 3,400 individuals who lost their life to COVID. But we also recognize the loss of a way of life for all of us. Kids not in classroom, businesses closed, activities limited. And as we look back over the last year, as difficult and hard as it is, I think San Diegans have a lot to be proud of. I think we have taken action that we know has saved lives, with the death rate significantly lower than other states, lower than any surrounding county, lower than the state of California. We also got through this without overwhelming our healthcare system. And we're now working and making progress to come out of this, to truly build back better, to get our economy back up and running, and to safely and responsibly, and that is important, safely and responsibly work our way out of this pandemic. One of the first steps will be descending from the purple tier into the red tier. We have a high degree of confidence that next week we will be able to descend into that next lower tier. Our case count was 8.8, which is down from 100. Show you how far we've come since January, or almost 100. How far we've come since January. If we have another week next week, like we had this week, then we will be in a position to descend as early as next Wednesday. We'll obviously have to monitor and track where we're going, but we're certainly on the right track and trajectory, and that'll be good news for restaurants and gyms, and frees up some things surrounding schools and other things. And so we're excited about that. Also today, the U.S. Congress passed the Stimulus Act, and that is encouraging about $1.9 trillion of relief. We think about over 600 million of that will come to San Diego County government. We have a lot of bills we got to pay around vaccines and public health efforts, but we'll certainly be looking and working with the community to develop ideas of where can we fill in the gaps. You've got state funding programs, you've got federal relief coming in, but how can we step up and make a real difference and try and help folks get back up and running. So we're excited about that. CDC guidance recently came out for folks who are fully vaccinated. Individuals who are fully vaccinated can gather indoors with other folks who are fully vaccinated without a mask. And again, I talked to a couple folks today who were, they had both seniors, they had gotten their vaccination second dose. They had a couple of friends, family that had gotten their second dose, and they were looking forward to having the dinner together this week. And so there's some, again, progress being made in providing more opportunities for folks who are doing that. If you remember in the early days, and even up until early days of this year, we were really worried about running out of healthcare facility beds. And we set up a federal medical station and an alternate care site at Palomar. And we're now in a position that we can wind that down. That's going to go into a kind of soft shutdown. The gear and equipment will go into storage here in the event that we need it again. But there's been zero patients there, and the strain on our healthcare system is much less. And so that is a positive effort. With vaccines, we continue to have a shortage. We don't have enough certainly to meet the need, really trying to fulfill those second dose requirements. There's not a lot of first dose appointments out there, but we are encouraged that we continue to move faster than any other county in California in number of vaccines administered per person. 1 in 4 San Diegans, 25% have received at least their first shot. I talked to Dr. Paul Gothold, who said the first dose has been offered to every single school and school personnel in San Diego County. And so we're seeing tremendous progress there, progress with seniors, progress with efforts around the homeless. Chief Meacham will talk about Operation Collaboration, a lot of what they're doing. And then we're going to continue to build out capacity. We know the supply will increase. We hope very soon. I love watching President Biden say the vaccine will be available for every adult by May. We're in March, so we could start using some increased numbers so that we can get it to everyone by May. But, you know, this week I was with Mayor Gloria at the convention center. We're transitioning the unsheltered San Diegans who have been sheltering at the convention center are leaving the convention center. And we're preparing for how do we stand up that convention center as another super station. We got to wait for the vaccine to arrive, but we want to be ready that when we get a significant jump in vaccines, that we're there and we're ready to roll and get all those shots in arms. And so another step forward. And then March 15th on Monday, we'll be opening up eligibility for folks with underlying health conditions. Again, could be some limitations on number of first dose appointments available, but in anticipation of supplies increasing, we will be doing that on the 15th. On our website, you can see a list of some of the conditions that are eligible: cancer, chronic kidney disease, chronic pulmonary disease, sickle cell, obesity, Down syndrome, and others. And in the next 24 to 48 hours, we'll be posting on the county website information on what you need to do in terms of documentation to show that. We think our healthcare system partners will be most effective at this. Hospitals and clinics reaching out to their patients that they know have underlying health conditions and getting them in. But we will make our public sites available for individuals as well. We know not everyone is in the healthcare system. Not everyone has a doctor or a place to go. And so we'll be making them available. And again, we'll post information on the website about how individuals can attest that they have these conditions. So a lot of forward momentum, a lot of progress. We're excited about where we're going. And you know, we're very mindful and cautious. The virus is still there. You still need to wear your mask. You got to avoid high-risk settings. Let's not change our trajectory. Let's keep our trajectory going where it's going. But we know it's been a long year, and we're pleased to be in a position to start working our way out of that. So let me share with you three quick slides, and then I'm going to kick it to Supervisor Vargas. This one here is a vaccine dashboard. This is available. All of you can go to our website, see this site. It's updated in real time. You see total doses administered. We had an exciting day with our millionth vaccine, and we're over that now. You see those pending documentation. They've been given. They're just getting uploaded in the system, and those scheduled. And, you know, you can add up those numbers and see we've got more of that than we have doses received. And so we need to get some more doses. We could probably do 2-3 times as many per day as we're doing, but we're hopeful that comes. And again, on the top there, San Diego County residents vaccinated, almost 25%. That's great. And then those fully vaccinated, generally 2 shots. We did get the J&J day rolling percentage of average continues to trend down. That is very encouraging now at 3.1%. And then our total case numbers are down. You know, we oscillate there 100, 200, 300. But again, considering we were in the range of 4,000 a day, this is good. Test numbers are low because people aren't really seeking out the testing as much. Testing remains. It remains viable. It remains available. Any San Diegan who wants to get a test should go and get one, but the numbers are lower because of demand. And then this last chart here just shows where we are, kind of a complicated chart. But if you just look on the bottom left-hand corner there, you see 8.9 and 8.8. That's our case rate right now. And traditionally, to get into red, you've got to get to 7 or below. But because of the presence of the vaccine, we think this week that number will change to 10 or below. And so we would need 2 weeks under 10. This would be 1 week. We think next Tuesday would be our second week. And so again, we have a high degree of confidence. Things can always change, but we have a high degree of confidence that next Wednesday, we will descend into that red tier, which will open up a few more things and continue our pathway and our efforts around recovery. So again, thank you all. We'll kick it over to Supervisor Nora Vargas. Then we'll hear from Dr. Wooten, Chief Meacham, and then we will get to your questions. Supervisor Vargas?
Thank you, Chair, so much for sharing that information. I do want to say that it has been a tough year for so many, and it feels like we are seeing the light at the end of the tunnel. I do want to give a big shout out and a big thank you, specifically to county staff for stepping up and really transitioning as we're trying to address some of the biggest issues in our communities, particularly around equity. And so, I was really glad to hear that last week the governor announced, that we were going to be getting 40% of California's income vaccination supply would actually be reserved for specific zip codes that were the bottom of the 25 percentile of the Healthy Places Index. There were 12 zip codes in San Diego County that qualified under the Health Place Index, including in Oceanside, City Heights, Golden Hill, Sherman Heights, Logan Heights, Barrio Logan, National City, San Isidro, Dulzura, Campo, Jacumba, Ranchita, and Warner Springs. And those were some of the top ones that were shared with us. And in the past week, I want to make sure that we emphasize that although there is about 5 vaccination centers located within those zip codes, the good news is that there are centers located very near to each one of these zip codes where our community members could go. And so we know that there are areas in the county that have been disproportionately impacted. We have been, continuing to look at different interventions to ensure that we're addressing the issues of equity. I do want to say that there were some zip codes that were not included, like 92154, which is in South San Diego, Otay Mesa, 91910, and 91911 in Chula Vista. And so when we're talking about equity, the communities in these zip codes would benefit from increased vaccine supply because they have been the most impacted. And so we're going to continue to advocate for that. We're going to continue to do what we're doing on the ground to make sure that our communities have access to vaccines as soon as they are available. And so one of the things that happens, and I think we've had a lot of questions around this, the Healthy Place Index does not take into consideration the number of COVID cases, but considers other health factors, and it also could, in the end, does the aggregate, right? And so in certain communities, the numbers are not showing up the way they should. So we have reached out to the state to ensure that hard-hit zip codes are included in the assigned health equity areas. I do want to mention though that I think it's important as we're looking at, as we're seeing that light at the end of the tunnel. I want to mention that our intervention programs that have been in place really are working in some of the hardest hit communities. The Promotora programs are working. The 211 expansion is working. The pilot walk-up sites, with no appointments in South Bay Superstation are working. And I do want to share that we know that some folks showed up to the Border View YMCA in Otay Mesa this past weekend. Even though there were signs, I know everybody's super excited about getting their vaccine. Unfortunately, we didn't have enough vaccines. We're working through the process to make sure that doesn't happen again. But know that that it worked, right? The walk-up sites are working, and what we're trying to do is really reduce barriers for our communities. So I'm proud to say that they've been successful, and we're going to continue to work on that, including partnerships in key areas for our workers. For instance, in the Otay Mesa community, bringing some of the healthcare workers to them so that they can get their vaccinations. And so we're going to continue education and really reaching out to our communities. You're going to see 2 different Spanish ads, one Spanish ad and one in English. That's going to be going out into our communities that I think, make sure that you let people know about them. If you have any questions, we're happy to answer those questions as well. Entonces, es importante mencionar que, como dijo Chair Fletcher, estamos viendo pues que en realidad las cosas están cambiando. Estamos viendo que pues parece que vamos a llegar a la etapa roja que le llaman para poder pues tener más, que ya estamos más saludables, ¿verdad? Hay más vacunas en las comunidades. Ahora ya tenemos 3 tipos de vacunas que nos están prohibiendo a las comunidades, y eso nos va a ayudar mucho. Sabemos que pues en realidad el impacto de las comunidades en San Diego, en el sur del condado de San Diego, han sido bastante difíciles. La semana pasada el gobernador Gavin Newsom definitivamente hizo una aportación muy importante, ya que el 40% del suministro de vacunas en California se van a reservar para los códigos postales que han sido más impactados, que están al 25% inferior del índice de lugares saludables. Y muchos de esos, hay 12 de ellos en el condado de San Diego. El condado ha hecho todo lo posible y seguimos trabajando para crear una infraestructura en donde no solamente hay sitios de vacunación que estén ubicados dentro de los códigos postales, pero cerca de nuestras comunidades. Así que sabemos que hay mucho trabajo que hacer todavía. Cuando hablamos de equidad, las comunidades en estos códigos postales pues se van a beneficiar mucho cuando haya un mayor número de suministro de vacunas, pues porque han sido las comunidades que han sido más afectadas. Así que seguimos comunicándonos. Es importante reconocer que el 15 de marzo es otro grupo que va a ser elegible para las vacunas. Eso es importante porque este grupo incluye personas de 16 años o más que tienen enfermedades graves como cáncer, enfermedades renal crónica, etapa 4 o superior, enfermedad pulmonar crónica, afecciones cardíacas, entre otras. Entonces, el condado en las siguientes 24 horas va a poder tener información que les va a decirles a ustedes qué documentos tienen que llevar para comprobar que pueden tomar estas vacunas. Así que sigan, por favor, vamos a seguir entregando la información lo más pronto posible para que la gente la tenga, pero más que nada no se les olvide que hay que vacunar, no solamente hay que hacer la cita para vacunarnos si pueden ir a los diferentes sitios, pero más que nada seguir tratando de hacer todo lo posible para pues mitigar este problema tan grande de la pandemia en las comunidades. So now it is my pleasure to turn it over to Dr. Wood.
Good evening, everyone, and thank you for being with us. I will briefly go over statistics related to our COVID-19 outbreak. Starting with the first slide here. It's basically our demographic slide that shows the total number of cases in the second column, 264,097 cases. This includes today's report of 349 cases. The average age for all of our cases is 36 years of age. 54% of the age group from 20 to 49 years of age make up all of the cases. So again, that age group makes up 54%. And then for gender, the demographics really has not changed in the last 6 or more months, 52% female, 48% male. And for hospitalizations, we are seeing a significant decline, particularly over the past 30 days, we have had a 72% decline. And that goes for intensive care or ICU admissions. We've had a decline of about 60% in the past 30 days. When we look at deaths, we have a total of 3,413. We've had 8 deaths reported today. The average age for deaths is 78, and the age range for all of the deaths is 10 to 106 years of age. And I neglected to say that the age range for all of the cases is from 0 to 108 years of age. When we, in the next slide, when we look at the epi curve, this really is a historical presentation of cases that are reported by illness onset date. And this obviously is a CDC practice. I want to draw your attention to the far right side on January 25th, when the regional stay-at-home order was lifted. We began to see a decline. And this was also in part due to the fact that we'd started vaccinations a month earlier. But also we realized that people are adhering to the non-pharmaceutical interventions, watching your distance, wearing your face coverings, and washing your hands. So that indeed is good news. If we go to the next slide, that slide shows, gives the different depiction of the daily cases. And we can see that over the last 6 days, from March 4th to March 9th, each day we have reported cases under 500. Moving to the next slide, this talks about outbreaks, and this also is a show of good news. About a month or 6 weeks ago, we were averaging in the 7-day period close to 100 outbreaks. Today, we reported in the past 7 days 16. The threshold is to see no more than 7 outbreaks in the past 7 days. So we are getting back to normal in that regard. And in the past 7 days, the total 16 outbreaks represent 60 individuals. Now, going to the next slide, this talks about the state monitoring metrics as it relates to our case rates. So we have our unadjusted and our adjusted case rates, and there's only 1/10 of a point difference between the two. This is related to testing. If you test far above the state average, your adjusted case rate will be much lower than the unadjusted. And if you are below, you run the risk, counties run the risk of the adjusted case rate actually even being higher. But this is good news for the county. We are still in purple, but our other 2 metrics are in the orange tiers. So the testing positivity percentage is 3.3%, and the health equity testing positivity percentage is 4.5%. Moving to the next slide, this shows our vaccination prioritizations. We started vaccinations, phase A, on December 15th, vaccinating healthcare personnel and long-term care facility staff and residents. Then in phase 1B, we started out initially on the 18th of January vaccinating 75 year of age and older, and then moved to 65 to 74 on January 24th. So now we're vaccinating all individuals 65 and older. And then on the 27th of February, we opened up the 3 sectors: emergency services, education and child care, and food and agriculture. And on Monday, we plan to open up 16 years of age, 16 rather, to 74 high-risk populations. Moving to the next slide, these are the next couple of slides. These are just the our ecosystem, vaccination ecosystem. We have our county-hosted sites, our super stations, as well as our mobile vaccination teams, which is an entree to for Chief Meacham to talk about the activities that they are conducting. And you see the other partners. The last 2 partners, those are really federal partners. We don't get the vaccination numbers from Military and Veterans Administration, but when we talk about pharmacies, there are really 3 buckets there. There's the initial federal partnership between CDC and CVS and Walgreens to vaccinate long-term care facilities and SNFs. Then you have the partnership between CDC and commercial pharmacies that started on February 12th. And various pharmacies now, you can go there and get your vaccine just as you can your influenza vaccine. And then the next bucket are pharmacies that are partners with the county. This includes some commercial pharmacies, but also includes the more private pharmacies. So going to the next slide, this is a map of all of the vaccination sites, and the red circles are our pharmacies. Then we'll skip the next slide because we've talked about the case rates. So in closing, I would just like to remind everyone that we want to adhere to the CDC 4 Ws, wash your hands, watch your distance, and wear your facial coverings. And if you are sick, stay home, isolate, get tested, and when it is your turn to be vaccinated, we want people to get the COVID-19 vaccine. Now I'd like to turn it over to Chief Meacham.
Well, thank you so much, Dr. Wooten. I'm going to share my screen here with you. Well, good evening, everybody, and thank you for having me on tonight. I just wanted to spend a few minutes talking about Operation Collaboration, and Chairman Fletcher reminded me that it's been a year that we have been at this. About a year ago, we were asked to assist the Health and Human Services Agency with COVID testing. And a lot of this was predicated on our ability to be mobile. We're used to taking medicine, so to speak, into people's homes. And in December, we were asked to have our paramedics and EMTs assist and become vaccinators. And so the premise of this was that we wanted to provide access to vaccination across all of our communities across all of San Diego County. We partnered with 25 other fire and EMS agencies, all with a single unified mission of serving our communities and really a focus on the most neediest. So once we were vaccinated, our first efforts were centered around long-term care facilities. At the time, the majority of the people coming into intensive care units were our seniors, our most vulnerable populations. So we have been to 263 long-term care facilities, and we vaccinated first and second dose nearly 6,000 of some of our most vulnerable populations with our seniors. Dr. Wooten or Supervisor Vargas talked a little bit about the health equity. We recognize that the rural parts of San Diego County lack great access to healthcare, and so we have taken points of distribution all over the backcountry to some of the neediest areas, including Campo, Warner Springs, Jacumba, Jamul, and very soon we will be moving into the Fallbrook and North County area. So we've been to 8 sites, 28 different days, and we vaccinated nearly 16,000 people across the rural backcountry of San Diego County. We were then asked when the next tier opened up to really focus on the agriculture community. And this is something I think that our firefighters and paramedics are probably the most proud of. These are some of the hardest working people in the county. For them to online schedule an appointment takes them away from work. So we were involved in testing with our agriculture workers. So we're literally calling nurseries, agricultural operations, and asking them, hey, can we come out to your job site, take a few minutes and vaccinate? We help, we do all the paperwork, get the entry. And so this week we have 3 sites, and for the next probably 4 weeks, we're going to continue to focus to make sure that all of our agricultural workers have access. And so in closing, we're going to continue to stay focused on our mission and really try and be that kind of surgical scalp of providing vaccinations where it's needed. And before I turn it back over to the chair, I just want to make a comment that it has been incredibly rewarding for our staff to go out and be there as people receive these vaccinations and the smiles on their face. But I want to thank Dr. Wooten and Nick Mascioni and their staff. There is literally hundreds of people that work behind the scenes to make all this happen so that we can be out in the field vaccinating it. And so with that, I'll turn it back to Chairman Fletcher.
Thank you, Chief. Appreciate again all of the work of all the agencies that came together to make that happen. With that, let's open it up for questions. Let's do a couple questions, then we will let folks enjoy the rest of their Wednesday evening.
All right, let's get to that first question. Per the California COVID website, modifications will still be required when we achieve the minimal tier. What is the criteria for all businesses to open without restrictions?
Well, I think when you look through the tiers, those are situations where we are still dealing with COVID, and I think the presence of the vaccine is already creating adjustments to the formulas underlying the tiers. And so I think as we move through everyone being able to access the vaccine and those numbers continue to grow, then we'll move more rapidly through the tiers until we reach the bottom of them. And at the point that we hit herd immunity, then the restrictions will be lifted and we will go back to normal life. So, you know, we want to be mindful and careful. We're making tremendous progress. Again, our cases went from our case rate being at 100 to now being at 8.9. We're leading the state in vaccines. We've got to continue to do it responsibly, but we're on a path and trajectory to work our way out of this.
All right, the next question, kind of along the same lines. What will the criteria be to end the mask mandate?
Well, again, what we'll see as we get there. We're just at the point where we're working our way through. You know, look, other states, I've heard a lot of people say, you know, we want what Texas has. Texas got rid of the mask mandate. Texas also has a death rate almost double that of San Diego. And I'm pretty sure we definitely don't want that. New analysis out today is predicting the California economy will recover much faster than the U.S. economy as a whole. So I think we're well positioned, but we want to continue to be safe and continue to be responsible. And you know, 1 in 4 San Diegans have gotten at least one shot, but that means 3/4 of San Diegans have not. And they're still at risk of getting COVID. So let's keep wearing the masks. Let's keep our physical distancing, and let's work through this and see how the situation evolves as more people get vaccinated.
Next question, is there new guidance for outdoor weddings since there are other outdoor events being allowed like concerts and sporting events?
Yeah, let me ask Dr. Wooten. I know they're working on it. I've been talking to some folks at the state about this outdoor events. We need some guidance around that to get that back. I'm not aware that anything has come out yet, but let me ask Dr. Wooten if she has any more insight on that.
Thank you, Chair Fletcher. I actually just ended a call at 5:30 with the California Department of Public Health. They are working on guidance specifically for weddings, and it should be out soon, but usually when they say soon, that's no definite date, but it is coming. Thank you.
Soon is flexible. Soon, as we've learned in COVID, soon is a very relative term. All right. Next question.
All right, the next question. There are no appointments available for the second dose whenever I look on my chart, the county sites. Yet in Los Angeles, there's plenty of appointments. Why is San Diego so low on supply?
Well, I don't think, I mean, look, everyone is dealing with the same constructs. I mean, I don't know how it is that we've administered more vaccines per person than LA County has. Maybe they just are really slow at getting them in arms. And so they have appointments available because it takes them longer to get them in arms. I don't know. I can't really speculate on what LA County is doing. All we can do is take the vaccines that we get, and when we get them quickly deployed, and we get them in arms faster than any other county. So I know it's frustrating. My father-in-law, who lives with us, had his second dose canceled 3 times and rescheduled. But hang in there. Eventually, it will catch up. And I think that the site that's had the most problems with second doses, the Petco site, they have conveyed they've got enough doses to do every second dose appointment for folks who got their first dose there, and so those should be scheduled and get in arms. And I think we'll see that smooth out a bit.
Okay, we've seen a series of questions regarding when other people will be eligible for the vaccine, like janitors, sanitation drivers / trash collection workers. When will that be?
Let me kick that to Dr. Wu and see if she has the latest update on the next stages.
About 2 or 3 weeks ago, CDPH basically said that after these 3 categories that we're currently vaccinating, we would go to age prioritization, which was the 16 to 64 high-risk populations, and then we would ultimately move into the 16, well, actually everyone over 16 years of age. I would imagine because of the outcry from across the state, other categories have been added on, and we will be adding those. They haven't officially made those announcements, but in our meetings, they have talked about what those various categories are. And so janitors are included in those other different sectors. And actually they will be including governmental workers, because all of those sectors were initially discarded and they were just going to focus on ages. But we will soon be announcing what the additional categories are. So, and most likely they will start next week on the 15th of January. So soon is sometime between now and the weekend.
And we have been vaccinating a fair number of janitors. You've got janitors who are tied to the healthcare sectors, or tied to the education sectors, tied to emergency service response, food and agriculture. There have been a fairly significant number of janitors that have already gotten vaccinated.
Okay, next question. Shouldn't we be encouraging testing, especially due to the new variants that have been found in San Diego County?
Well, we are encouraging testing. Testing's available. If you want to go get a test, there are sites all over San Diego County that are ready and willing to test you at a moment's notice. We're not going to force people to go get tested, but testing sites are there. There's capacity. There's availability. Any San Diegan should feel free to go get a completely free test.
Okay, the next question. We're told. Oh, sorry, Dr. Wooten.
Well, I just wanted to add also that as it relates to the variants, we work closely with Scripps Oceanography. We've been doing whole genome sequencing, particularly when it's associated with outbreaks, and then a randomization process. Now our public health laboratory can conduct whole genome sequencing. So we will, over the next weeks to months, see those numbers increase. And right now our numbers for the UK variant is 262 total cases that have been reported since December 14th.
Okay, the next question is in reference to people who have been vaccinated, fully vaccinated. We're told people who are fully vaccinated don't have to wear masks, yet we were also told you can still get COVID after being vaccinated. The latest recommendations are confusing. I thought we were supposed to wear masks to protect others.
Let's have Dr. Wooten set the record straight for you here.
So number one, no vaccine is 100%. So it is, you do have a small chance of contracting the illness if you are exposed to it. But what CDC is recommending is that if your parties have been vaccinated, that you can visit with other fully vaccinated individuals indoors without utilizing a mask or physical distancing. But if you visit with unvaccinated individuals from a single household who are at low risk for severe COVID-19 disease indoors without wearing a mask or physical distancing as well. So that might be a bit confusing because who knows what low risk is, but that is the recommendation. And then they are also asking us to refrain from quarantining or testing following a known exposure if you are asymptomatic. So those are the three primary recommendations. CDC will be coming out with additional recommendations as it relates to masking as time goes on. But this ties back to the question before when someone asked when will we stop wearing masks, really until there is no circulating virus in the community. And when things go back to normal, as Chair Fletcher stated. So that's the status right at this moment. These guidance came out on the 8th. We will be monitoring for additional guidance as they come out.
All right. Next question.
I think we kind of touched upon this, but this is a little more specific. What is the definition of pre-existing conditions in San Diego County?
Yeah, it's on our website. Dr. Wooten, you want to walk through some of those if you have them handy?
We will pull them up. We basically adopted the information that is on the CDPH's website, who obtained the information from CDC. Now, on the CDPH website, they only focus on those underlying health conditions that will result in complications. There's also another category for these medical conditions, and you'll see them here, these are conditions that may result in complications, and it includes complications such as asthma. It includes type 1 diabetes, type 1 diabetes, as well as hypertension. This list does not include hypertension, and it does not include type 1 diabetes. But these are the conditions, one or more underlying conditions that will or could result in underlying medical conditions. So we are actually asking for clarification from the state. Personally, we would like to include the additional category on the website. But all of those categories have been determined by the CDC, and we want to make sure that we have the largest number of categories so that those individuals that have the underlying medical conditions will see themselves there.
Good. All right, let's do one or two more.
This is the last one that was submitted. Someone here is just looking for guidance and any recommendations for those who have been struggling time and time again to make that second dose appointment. What recommendations can you give them?
Yeah, you just got to be patient. It's not everyone wants you to get a second dose. There's just been a shortage, and the supply of vaccines is completely out of our control. So keep checking back with the location where you got the first one. If you find a similar, if it's Moderna and you find Moderna at another site, you can get that second dose somewhere else. But they're all having shortages. So just hang in there. You're not going to have to restart. You're not going to have to redo the first one. Just hang in there, and we think it should catch up here real soon and get everyone done. All right, let me ask. Excuse me. Let me ask Vice Chair August if she has any closing thoughts for us this evening, and then we'll go to Dr. Wooten, and then we'll wrap up.
Bless you, Chair.
Thank you. It's cold outside. I'm sitting
I was going to say,
it's
you're
cold.
outside in the cold.
I didn't get rained on, though. Like that, I was worried.
That's good.
People
It's a
looking
good
up.
sign.
Yeah.
So I just thank you for that. And I just want to, I think, emphasize and remind folks that we're doing everything we can to make sure not only that we get the vaccines, but making sure that we get as much information out to our communities. And so helping our neighbors is really important, working together, making sure that we find ways of ensuring that not only people get their appointments, first appointment, second appointment, but then also to make sure that people have the information that they need and understand how the vaccines have been FDA approved and they are safe for us. And so I just want to make sure we continue to emphasize that. Y a las comunidades que hablan español, nomás enfatizar que es sumamente importante que cuando tengan la oportunidad de tener su vacuna, que tengan su vacuna, porque es la única manera que vamos a poder regresar a nuestras comunidades y seguir, pues, regresar a las escuelas y a poder trabajar. Así que hay que ayudar unos a otros, a sus vecinos, para que puedan tomar su vacuna. Aquí estamos seguimos abogando para que pueda haber acceso a vacunas. Muchísimas gracias y buenas noches.
Thank you. Let me ask Dr. Wooten if she has any final thoughts for us this evening.
Yes. Previously, I talked about what people that have been fully vaccinated can do, but I want to remind people that have been fully vaccinated what they should also continue to do. And for now, CDC is recommending that fully vaccinated people should continue to take precaution in the public. So as you go out into public, we wear our facial coverings when we go to the grocery store and all businesses. We want people to continue to do that, and also to physical distance. Also, we want individuals that are fully vaccinated to wear their masks when they come in contact with unvaccinated individuals or a single member of a household, and also when they are visiting unvaccinated individuals from multiple households. And then we want people to avoid medium and large size in-person gatherings. That is still a risk. And then lastly, as stated before, we want people to get tested if they experience COVID-19 symptoms. Thank you.
Wonderful. Thank you, Dr. Wooten, and thank you to everyone out there. We know it's been a long year. We got to keep being cautious, keep being responsible as we work our way out of this. But I think San Diegans can be proud of the really difficult work that's been put in over the course of the last year. Our whole community responding to this issue, coming together, supporting each other, helping each other, and feel cautiously optimistic about where we're headed. We got a ways to go. We know that, but for the first time in a year, it feels like we really are turning the corner and beginning to move in a new direction. So thank you all for joining us, and we will be back with you most likely in 2 weeks with another COVID town hall. Thank you all.